Hey guys, Dr. Tammy here. I had a post last week asking what you guys would like me to talk about, and somebody said skincare. So I'm going to tell you all the things I do, and this is a hot mess. I know you can't see my table right now for a reason because it is just a hot mess. But anyway, I'm going to share with you a few things that I do, and I wanted to just really keep it simple to like three things, but it's just not that simple when you're 54. But I think that you can always start early and really take care of your skin. I'll just be transparent. I've done Botox for probably 20 years, and I have so many different things that I have access to in my office, fillers, all sorts of things. So I'm not talking about those things. And also, there's plastic surgery, and I'll let you guess whether you think I've had that or not. But anyway, all sorts of different options. But if you want preventive care, I'm going to say number one, stay out of the sun. If you are in your 30s, 40s, guys, females, either way, stay out of the sun. You know, we used to be sun worshipers and we would use baby oil and iodine, and I am paying the price for it. So I will say now, little plug, we just got an IPL laser machine in our office. And so if you'd like to know more about that, let me know, or you can comment, or you can check out our website, healingartcenters.com. But anyway, enough of my plug. I'm just going to share with you some information about what I do. So anyway, let's get the prescription stuff out of the way, because as long as I'm plugging my practice, might as well tell you some things. But you can ask any doctor to prescribe these things for you. However, with bioidentical hormones, you're going to want somebody who really knows what they're doing, who can really individualize your care. But I would not live without my bioidentical hormones. I mean, it's so important. And collagen structure comes from mostly estrogen. And once after menopause, our ovaries dry up, our estrogen dries up. And so it's really hard to keep that skin integrity, that elasticity. So hormones are a really big deal. And men with testosterone, that's a thing as well. Retin-A, love it. It can make your face peel if you use it too often, so be careful with that. I probably use it about 2 or 3 times a week. It will exfoliate your skin a little bit, and I don't really have anything here for exfoliation, but I will. I have some glycolic pads I'll show you in just a minute, but I love Retin-A. And then just recently, I did a video on this the other night. This is a topical estrogen cream. So even if you don't feel like bioidentical hormones are right for you, a topical estrogen cream may just be amazing. I love it. I've only been using it for about a month, but I can really tell the collagen and the plumpness in my skin, and I freaking love it. So, okay, let's move through. Also, a little bit on the inside is a collagen powder. And of course, we have this in our office or on our website, carbmelt.com. This is more of my carb melt line. But collagen, this one has 5 different collagen structures in it, and there's tons of research to show that this really does improve the matrix of the skin and the collagen, so super important. And let's get to a little bit about cleansing, especially if you have something called milia, which have plagued me and plagued me and plagued me my whole life. They are little white kind of pustules that happen on the skin, especially under the eyes where the skin is very thin, and those are basically blocked ducts. I've been fortunate that I don't have acne or haven't had acne, but those milia, I don't know if that's a trade-off or not, because they will haunt you your whole life. But what I have found is that if I cleanse my skin really, really good, especially under my eyes, they're very minimal, if they're at all, and the IPL laser takes care of what. Sometimes I wear a little bit thick makeup, or you're going out, so you want to make sure that you get everything off. So I always use a good cleanser. This is a Neutrogena cleanser. And then I have this thing called the Face Halo. This thing is absolutely amazing. It gets all the makeup off. I don't know what the secret formula is in this. It just feels like a fuzzy terry cloth, but it is amazing. And then you just rinse it out, and they actually come white. So I've got some makeup on this one. It's time to wash this one, but you just throw it in the washing machine and it's good. And then one of my secrets is baby wipes, and you can buy the Neutrogena face wipes. I find that these work really well. And if I still had the milia, I would tell you it's worth the money to buy the makeup remover pads, but these are, pretty cheap. So that's cool. And it works really well. A couple of times a week, I will do a little bit of microderm. I have like a little machine I use. I won't bore you with that. If you want to know, I can tell you. But these are glycolic acid pads, and really good for getting that superficial layer off. And it's sort of like a chemical peel, which when you have chemical peels, this is one of the things they use. And this is a pretty strong one, so be careful. And then you want to rinse it off with cool water, but it's kind of like doing your own chemical peel at home a couple times a week. So if you use it too much, you will kind of flake off a little bit. So we also have an esthetician who's going to be starting in our office next week. I'm super excited about that because I do love chemical peels. They're miserable, I will tell you, because you cannot wear makeup because your makeup will just like peel on top of it. But they're amazing. They make your skin look and feel wonderful. So highly recommend those. Also, a good toner is nice. This is a one of my estheticians gave me, and it's cucumber hydration. But this company is Skin Scrub. So I don't know. I'm not really a skincare snob. I mean, you can see I'm kind of all over the place. I don't like to spend a lot of money on my skincare. I just want it to work, right? So, and if I thought it was going to be amazing, of course I'd spend a little bit more. But okay, now I have a few little things here that I really like, and I kind of mix it up a little bit with my Retin-A. I do use my estrogen face cream every night, but this is a hyaluronic acid serum. And I haven't really found, you guys can tell me if you have one. I'd love to hear your comments. Haven't really found a good serum that has like all the hyaluronic acid and the glutathione and the vitamin C and all the things in one. So I kind of make little cocktails and I just switch them around and kind of play with them a little bit. And this is a vitamin C. Vitamin C is great for the skin. I don't have it out here, but I love supplements. I take a ton of supplements besides the collagen powder. I take about 4,000 milligrams of vitamin C a day. And this is crazy. I knew a lady one time when I was in my 20s and she was in her 40s and her skin was amazing. And I was like, how do you do that? I could not believe she was in her 40s. She looked as young as me. And she said, I take 4 grams of vitamin C every day. So I've been really religious with that. So I don't know how much of an impact that's had, but I love vitamin C, and a topical vitamin C is good as well. If you struggle with acne, I have another video that I did. You can go back in my feed and scroll and watch that too. And I have all sorts of cool things in there about acne. I've never had acne, so this is a little bit more wired towards dry skin, which I've always had. And that goes along with thyroid issues too. So I've had low thyroid issues most of my life. So this is more dry skin, which makes wrinkles worse as you age. So, oh my gosh. And then you go through menopause. You really have to work hard at this, but it doesn't have to be expensive and it doesn't have to be a lot. And like I say, I switch some of this up sometimes. I always wash really good under my eyes. That's a thing. But so this is another retinol renewal serum, and I really love this brand. It's called Braylee, Breylee, and I don't have any stock in these companies. I wish I did because I love this purple retinol one, and you can just Google that if you want. Go online. There's a lot of different companies that carry this. So I love this under eye cream, and that crepiness that you can get after your 40s and 50s, it's wonderful for that. And I always put that on before I put my makeup on, so I don't have a lot of crepiness going on. And then as far as just a topical cream, we do have this one in our office. It's the crepe cream. This is a special formulated that I made because I'm like, why can't you find a good thick cream? Now this is for dry skin. You would not want to use this if you have prone to acne or oil blockage in the skin. So another thing too with hormones is most women don't even realize that they can take testosterone. Testosterone is wonderful for skin and for keeping the skin having its normal oil levels, which is why a lot of times people who have acne have a lot of extra testosterone. And so if you are menopausal and you do have dry skin, testosterone is great for lots of things like muscle and libido and all the things, but can really help hydrate the skin as well. Oh, I just said hydrate. Let's talk about that. Hydrate. Water, water, water. I carry water around with me all day long. And there are so many studies to prove that internal hydration affects the skin hydration, and that old 8 ounces of glasses of water a day is not true. It's based on body weight. So you can go and look, just Google, body weight and hydration requirements. But anyway, love this. And then the last thing is, this is actually hair cream, and this is Blue Magic coconut oil. And I love coconut oil. You can use any kind of argan oil or anything like that, but this is kind of a petroleum. It's pretty thick. And I put this around my lips at night just for the fine lines and wrinkles that can form. And then I also go really heavy on my neck. Now, because I have those milia and I'm prone to those blocked ducts, especially under my eyes, I do not put this under my eyes. I might put a little bit over here where you can get the crow's feet, but really great for the neck, and it does kind of feel a little sticky and kind of have to let that ride a little bit, but and absorb a little bit, but it kind of packs in that moisture. So this is wonderful. So just a few things, just a few things. If you want to do some takeaways, you can go, fast forward this or rewind it. But these are kind of the basics that I do, and there's probably more that I haven't thought of, and I'll probably do more videos. But hope this was helpful. I love you all very much, and I wish you the best, most beautiful skin ever. I'll see you later. Mwah.